Okay, so what we're going to talk about now is a breakthrough study, really breakthrough study on chronic fatigue. Sometimes it's called myalgic, excuse me, myalgic encephalomyelitis, meaning myalgia, meaning muscle pain. The brain is not functioning and the nervous system is inflamed. So that's what this ME, myalgic encephalitis, or chronic fatigue syndrome. And the main thing there is fatigue that gets worse with exertion. And what they found, which is groundbreaking, is that there's a dysfunction of the integrative brain regions, these brain regions that integrate what's going on within you and what's going on without in the world around you. And these are the parietal areas primarily, which is above the ear and a little bit back. The parietal areas on the right and the left. And what they found that the muscles are normal. I'll show you all the things they tested here. Muscles, motor, cardiopulmonary, body composition, brain imaging, autonomic function, the cerebrospinal fluid. They look at all these things to see, are these people different than normal controls? And the answer is they were not different. Their muscles were the same. Their cognitive functions when they tested them were the same. The cerebrospinal fluid was the same. Their autonomic function may have been disturbed a little bit. Their motor functions of strength and grip and motivation, their strength and their muscle fibers were actually normal, but their ability to persist and push through the task was actually reduced. They were like, oh, this is too hard. I can't do it. It's really too hard. It makes me so exhausted. I don't really want to do it. This is just too much. But they didn't find any physical reason for that. These are people with chronic infections. And then what they found, the real difference was here in the brain. This is the right parietal area here. This is, the ear would be here, if you could see my cursor. Right here, these yellow areas, the right parietal area, and this was abnormal in these people. It so happens that I was treating a patient before I read this paper and looking at his quantitative EEG and deciding where to treat him with the laser, with the photobiomodulation. And we treated a couple areas, but this area is one of the areas we targeted. And in fact, with the first treatment, he felt more relaxed, and then he reported that day that he was actually able to perform in various tasks. And he actually had a very good day. He does have them occasionally, but this was kind of interesting that he had it when we were targeting this area that was outlined in this paper. I've since treated another person, and I have some other people coming, and I'm seeing that treating this area does cause relaxation. And in one person, it actually reduced pain dramatically within minutes. So this is a big breakthrough for chronic fatigue. And the basic idea is this: you have infection chronically, and the infection produces these proteins, these peptides, these antigens. Your immune system reacts to it. And that causes a dysfunction in this part of the brain, which is also involved with adrenaline, really noradrenaline of the brain. And now we see that the sensations of chronic fatigue, a lot of it stems from the brain. And the last thing I'll say is that this is kind of like phantom limb pain. Phantom limb pain comes on, let's say, God forbid, you've been lost a leg. And then 6 months later, you lost your right leg. 6 months later, you say, oh, my right toe is itching. Well, can't be your right toe is itching because you don't have a right toe, right? Where is that coming from? It's coming from the brain. The brain creates the sensations. It's the same thing here, that this part of the brain has been injured or dysregulated by the chronic infectious process. And it appears, now it's 3 people, that the laser, the transcranial photobiomodulation, actually quickly improves this. Now, does the treatment have to continue on and on? We don't know yet. My thought is that if you treat the infection, that obviously will stop the damage. I'm not so sure, however, that it will reverse the function here because this area has been dysregulated. You might have to jumpstart it, and then maybe it'll come back, or you might have to do, chronic treatments, once, twice a week, 3 times a week or something with the laser. So that's a big breakthrough that we're seeing here at the Whole Psychiatry and Brain Recovery Center. Anyone have any questions?
So I think we have patients that this is going to be especially helpful for.
A lot of
And
pain,
a
actually.
lot of patients explaining their pain to them and their fatigue.
Yes, it's a real experience, but it's perceived as an energy deficit, but it's actually not an energy deficit.
Mm.
A motivational deficit is actually, yes, it's a motivational deficit, but it's really coming from this dysfunction of the brain. This part of the brain is working hard to integrate what's going on in the world, what's going on inside. It's a lot of work, creates a lot of anxiety, a subtle form of stress, and treating it with laser actually quickly brings a sense of relaxation because that part of the brain now has energy to function. And so now the brain can function, and you're not carrying this really an unconscious form of stress from, it's like the brain is not really working properly, and you feel it, you experience it as a non-specific stress.
Wow, amazing.
Maybe other, specific infections that target this area. I don't know at this point, but that's really a update, hot off the press.
Thank you.
Okay, very good. Thanks for all being here. And if you're interested, this is the team at the Whole Psychiatry Brain Recovery Center. We have Sean Abrashami,
Hello.
left upper here, and then we have Eiley on the right middle, and Dr. Morris, and we have Pauline here in the middle on the left, and we have Sarah, nutritionist, on the bottom left. Thank you all for watching.